Good morning, everyone, and a very warm welcome to Revive the Basics 2.0. Myself, Dr. Yamini Ramesh, and I welcome you on behalf of Asha Homeopathic Academy and Homeopathy Junction. Um, so, today we have a very special guest with us, Dr. Charuvahan from Tamil Nadu, and I'm really happy to have him on this platform. Dr. Charuvahan, warm welcome. And thank you so much for accepting this invitation and coming on this platform.
Hello, Yamini.
Hello.
Yeah, thank you. I should thank you for inviting me for this lovely session.
It's our pleasure, sheer pleasure for us.
Yeah.
And dear friends, I want to tell you that Dr. Charuvahan is a very close friend of me and Vaibhav, and he's a very accomplished practitioner. He has a experience of close to 2 decades almost, and he will be sharing a lot of tips today for beginners practice. I am sure that this is going to be a very useful and wonderful session. So I want to introduce our speaker today, Dr. Charuvahan. Okay. So, Dr. Charuvahan is an accomplished homeopathic practitioner, educator, and influential figure within the homeopathic community. He obtained his graduation degree, BHMS, in 2007 from a very prestigious Dr. MGR Medical University, Chennai. He has drawn inspiration and received training from prominent homeopathic experts, leading him to establish a most successful clinical practice dedicated to homeopathy for more than a decade. His approach encompasses specialized treatment methods and advanced diagnostic techniques, offering comprehensive homeopathic healing for various ailments. With over 18 plus years of clinical experience, he specializes in successfully treating a wide range of diseases using advanced homeopathic method. This also includes exclusive use of LM Potency. He's very good in using LM Potency. He teaches also a lot of times that how to use LM Potencies, which are known as some of the most advanced and safest methods of clinical administration in homeopathy. He approaches each patient with genuine compassion and heartfelt care, taking the time to understand their individual needs and concerns. And his demeanor is warm and supportive, creating an environment where the patient feels valued and understood. By actively listening and providing thoughtful, personalized support, he fosters the trust and comfort, ensuring that each person receives not only the medical treatment, but also emotional reassurance, bringing the benefits of homeopathic healing and joy to countless individuals across the world, focusing on addressing a wide range of health challenges. He also tackles various conditions, including autism, cancer, diabetes, hormonal imbalances, infertility, and many difficult diseases. Having completed his Dr. Sankaran's Gurukul program, Dr. Charuvahan has acquired in-depth knowledge of recent advances in homeopathy like sensation, superclasses, and the wise processes, and he has directly learned under Dr. Rajan Sankaran. Under the guidance of Dr. Charuvahan, Homeo Academy, it is an educative platform which he initiated, has been instrumental in training numerous homeopaths through seminars, webinars, workshops, and live clinical sessions across the country since 2009. So I'm so happy. I really want to say this again that he has come to this platform, and I have learned from him. I have discussed many cases, many things in homeopathy with him, and I have experienced that he has a very in-depth knowledge of organon as well. So he understands the thing and would explain to you that how it should be used, how it should be done. So today he's going to give us some very useful tips to become a successful homeopath, especially for beginners. But I know that this would be useful for everybody, whether you are a beginner or mid-level practitioner or a experienced seasoned practitioner. So Dr. Charuhan, now it's your turn. Please go ahead and
Yeah.
start your presentation.
So very long introduction it was. Thank you.
It is needed. Though
Yeah.
I hope I did not miss many important points.
Thank you. So good morning, everyone. So the topic today, what we have to discuss is about tips for beginners, right? So first, I would like to ask the participants what is their requirement as a beginner, as a practitioner. So, what difficulties are they facing? What kind of tips they needed? So, I think it will be better if we have some interactive session.
Yes,
So, participants can answer through the chat. I think.
yes. Even you can talk if you want to talk.
Yeah,
You have
yeah.
to just
Anything
like
is fine.
unmute yourself and please go ahead because it shouldn't be a lecture sort of thing. It should be interaction.
Because you see, it is always like cooking a dish and serving to someone. Okay. So, what we are serving to others should be liked by them.
Yes.
Yeah. So, I have some ingredients. I can make any kind of dish with those ingredients, but it should taste good for you, right?
Yes, so anybody, if you want to talk, you can unmute, or if you want to just write down, please write down in the chat box. Or you can also, I guess they can also talk about their difficulties, like what kind of difficulties they face in the beginning.
Sure.
Yes, so we have one comment from Dr. Sunita. She is asking, as a
Mm.
new setup of clinic, how to gather attention of patients?
Okay.
Very important question.
Very essential question also. Yeah.
So I also have one question, which
Sure.
I used to face in initial practice, and I guess a lot of people face that how to um, how to stay confident for a longer time, because in the beginning when you don't get enough patience or you don't get desired result, we tend to get disappointed that, oh, we are confused and obviously little unsure, underconfident. So how to stay confident for a long time and stick to the prescription or stick to the method
Hmm.
without getting disappointed. One more question from Dr. Astha. She's asking how to do case taking when patient is not telling anything relating to the disease, when patient tries to hide details, and how much how to do case study.
Hmm. Good question. Yeah.
Yes. Anybody else?
Any questions are welcome.
Yes. This is very, very good question. So I don't know the full name, Dr. SP. Nowadays, patients watch YouTube or Google search and come to the diagnosis along with the medicines to how to handle such cases.
How to handle YouTube patients.
Yeah. And this, this seems like a new age question.
Great. Hmm. So may I know the experience of the participants here? How many years they are practicing? You can just type on the chat box.
How to handle difficult one-sided cases and autoimmune disorders.
Hmm.
Also, guys, we request you to write down your years of experience. If you're a beginner, just write 0 or 1, whatever.
Okay, great. Okay, good.
Okay. So we have from
Hmm.
1 to 2 years to 24 years of experience. My God,
Hmm.
Dr. Sucharita. Thank you so much for your question, Dr. Sucharita. In spite of having such a long experience, you still want to learn. That is commendable. Hats off to you.
Can you see my screen?
Yes.
Yeah. So great. I will answer. I will try to give a solution for all your questions. So let me start with what I have now. So generally, as a beginner or as a homeopathic practitioner, what tips we need or what kind of challenges we face or in what area we need to get improve ourselves. So this is not a question for only beginner. See, as a homeopath, you will have these questions forever, right? So, the first thing is preparing yourself. So, how to prepare yourself as a homeopath? The second thing is what should I learn to be a good homeopath or to practice good homeopath? So, when things we start to learn, we need to unlearn certain things also, which is very essential. Okay. And how to acquire knowledge is the third thing which comes to the mind. So, with all this knowledge, what I have acquired, how I integrate those knowledge and apply them in practice. So, if I apply them in practice, and how should I maintain it? What kind of management I should do with the patient? And finally, how to manage my clinic. So, usually, all our queries can be put into these six categories. Is there anything out of this box you need to address me? Right. So, how to prepare ourselves as an homeopath? So, for this, the one thing which most important is inspiration. So, in what way you have been inspired to become a homeopath? Any ideas, any thoughts from you? How you inspired to become a homeopath? Anyone can share your experience. Anyone is ready to share your experience? Great. Yes. So, not getting admission to MBBS is one of the greatest inspiration to become an homeopath. Yeah, great. So, I will just share some of my life stories where I am inspired by few homeopaths, which made me to stick to homeopathic practice. Okay, I was introduced into homeopathy, or homeopathy was introduced to me when I was studying ninth standard. I had a jaundice. Then my father took me to an homeopath who is an lay homeopath. And I saw his clinic, and his clinic was flooded with patients. So many patients were there. And when I went for treatment, I was just first inspired by his way of approach with the patient, how compassionate he is, how carefully he asks each and every details of my illness, my body symptoms, my mental symptoms. And he gave me a medicine and I recovered. So this was my first inspiration. The one is the crowd in front of the clinic, and the second thing is the compassion and the way of approach of an homeopath to the patient. So on that day, I decided to become a homeopathic doctor. Then, after joining the college, during my internship, after completing the college studies, we all graduate from college after studying 5.5 years of homeopathy, which is not sufficient for us to start our practice. So we need more practical training. So I went to another homeopath who was a bank manager in the past. Due to his homeopathic inspiration, he resigned his bank job and he joined an homeopathic college to get an homeopathic graduation, and he was studying in a college at that time when I was doing my house surgeon period. So I went to his clinic to get trained. I used to go there daily. I used to see patients. He will teach us all the methods, and he gave us many opportunity to see the patients and everything. So this dedication and the determination of his commitment towards homeopathy, where he needs to learn and practice homeopathy in a right way. So he joined a homeopathic college at the age of almost 40-45. He joined a college and he completed his degree, and he is still practicing a very good homeopathy till now. So this inspiration made me to gain more confidence in homeopathy, more respect towards homeopathy. See, the another story which I experienced in my life is during my internship, I went to another homeopath who was a teacher. I went to his clinic for the first time, and he was an homeopathic consultant in an allopathic hospital, where the allopathic hospital has given him a separate consultation chamber for homeopathy. It's a cancer hospital where he will treat terminal cases of cancer with homeopathy also. So the first inspiration which I received from him was, I went to his clinic and I was sitting, a patient came. Both were sitting silently. He asked one question and the patient was just thinking, and it was almost 20 minutes. He never spoke another word, and patient was also just in a silence. And after some time, the patient said one symptom, and the homeopath referred a big book which we call as a repertory. He searched the entire page and gave him one pill of a medicine dry on the tongue. Then he asked the patient to leave. The patient left. So this was one big eye opening in my homeopathic journey, where I see a homeopath prescribes just one pill as a medicine, so which I have never seen before. So this gave me more confidence towards the homeopathic principles and practice. So as a homeopathic doctor, as a beginner, we need such good inspirations to start or to prepare ourselves as a homeopathic doctor, right? So we all know our sole authority for homeopathy, the ever not outdating authority of homeopathy is Dr. Samuel Hahnemann. So when we get inspired from the homeopaths, what we see in front of us, who give us some inspiration. So what inspiration should we get from Hahnemann? So have any one of you have been inspired from any work of Hahnemann? What inspired you the most from Hahnemann's teachings, Hahnemann's contributions, Hahnemann's inventions? What inspired you the most? So someone has answered. Humanity, very good. Humanity, very good. Anything? Good, good. So there are three things which we can take from Hahnemann's life that will be inspiring us to be an homeopath. One is dare to be wise. The other thing is imitate me, but imitate me well. And the final one is I have not lived in vain. So these three are the words of Hahnemann which we should never forget in our life. Okay. So dare to be wise. What does it mean? So one is be open to learn. Learn the right thing in the right way. Whatever you have learned, you should share it. Okay. Yeah. The second one, imitate me, but imitate me well. So you should know that no person in medical history has worked, invented, and completed one medical system except Hahnemann. The science of homeopathy was invented, initiated, progressed, advanced, refined, and almost completed as a complete system, as a whole system of medicine by a one single person. So that is his way, and there is nothing to add or delete in what we has he has given to us. It is complete, and our duty is to understand what he has said in his way and follow it as it is. So the final thing is the dedication and determination and the love for humanity that Hanuman had, which made him to spend almost half of his lifetime for the humanity and for homeopathy. With this inspiration, we should prepare ourselves to be an homeopath. So this is the first step what we need to have in our mind, okay, as a beginner or even as an experienced practitioner also. So what this inspiration will give? So the inspiration will give you two things. One is confidence in learning and in unlearning, to start your clinical practice with confidence and the confidence to heal. So which is accompanied by the faith in homeopathy, the faith in the fundamental concepts of homeopathy, the organon, materia medica, and repertory, which should not be neglected at any cost, in all the principles of homeopathy, which brings you faith in yourself to stand as a homeopathic practitioner with proud. So that is the first inspiration which you need to gain. So what is the message that organon teaches? Anyone? What is the main message that is in aphorism 1 and aphorism 83? Anybody? See, many of us, if we are in college, we will be thinking that organon is a theory. So we will segregate the aphorism. We will just chop it out, right? Aphorism 1 to 82 is theoretical part. 83 to other things are practical part. So we used to chop it off and we used to read for exams. We write it for the answers. But what really organon teaches us is very important. So I couldn't view the chat. Can anyone? Any answers has come? How to become a true practitioner? Okay. Okay. Wait a second. I couldn't able to. So the first thing the aphorism 1 teaches us is the mission of a homeopathic physician is to heal. The healing is the only mission which you need to be keep in your mind, and the healing should be as it is termed by Hahnemann in his organon, as the principle said. Okay, so this should be our first primary key note of our practice. Right. To attain this, what qualities a physician should have is very important. The four qualities which he describes in aphorism 83 is not just for case taking, it should be for our entire life. So one is free from prejudice, B with sound senses, B with fidelity in tracing the objective, and be attentive in observation. These five qualities, as a homeopath, we should be very skilled with these four qualities, right? So all this organon theory, whatever we read, we studies are not just theory. Every aphorism is an outcome of the experience that what Hahnemann had through thousands of cases. Okay, so each and every line of organon, every word of organon carries a respectful high value. So with this, we start our learning. Before learning, the first thing is we should unlearn certain things. So what are the things that we should unlearn? One is the speculations and theories, which we used to heard something that this is homeopathy. Like you gave this medicine to this disease, an X medicine for an Y disease. So these kinds of concepts and theories which we keep on hearing and which is pushed into our mind during our college days, during our initial practicing days. So all these ideas should be unlearned at certain point. So this is your first step to learn what you want to do. Learn Learning is a process of evolution. Uh, Actually, yesterday a young practitioner came to visit me for some cases, and we were just have some we had some conversation, and she asked me that, sir, it's almost 18, 19 years that you have you are doing this homeopathic practice. So what you have learned so far? What is your experience in these 18 years? So I just said her that I think I need to study more. So learning is never ending for a homeopath. So you should keep on learning and you should keep on unlearning the unwanted things, which will progress your career, develop yourself, and which will make you a successful homeopath. So when it comes to learning, you can see the homeopathic field has varieties of learning materials. There are different methods, there are different homeopaths. Every homeopath has their own perspective. If you go to an A homeopath, he will be practicing a B method. If you go to a C practitioner, he will be practicing a D method. So you will keep on running between this ABCD and you don't know what to do. So this is one basic problem what a beginner faces. So how to overcome this? So how to learn and unlearn? What to learn and unlearn? Okay. So for this, first thing as a beginner, you should have learned or you should have a strong foundation in the basic subjects of homeopathy, that is organon, materia medica, repertory, and the other principles such as provings and other cardinal principles of homeopathy, right? So when you know what to learn and how to learn, then the journey of learning goes on like this. So you all be well accomplished with this aphorism number 3, right? So can anyone explain me what is aphorism number 3? You can speak than to write in chat box. You can speak. Am I alone? Hmm. He should know what is to be cured. Yeah. Knowledge of disease. Good. And what to be cured. Hmm. Great. So, according to me, the aphorism number 3 carries the entire organon within itself. So, let us just try to decode the aphorism little bit. Okay. What does it says? See, if the physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, knowledge of disease, that is indication, if he clearly perceives what is curative in medicine, that is to say, in each individual medicine. So you should be very careful in reading the aphorism. See, Hahnemann doesn't says just like if he knows what is to be cured in disease. So what is to be cured in a disease is a question, and also he puts another thing that in every individual case of disease. So what does it mean? And the next thing, when it comes to medicine, every medicine is a curative medicine. But what made Hahnemann to put each individual medicine? That is to say, in each individual medicine, you should think about it a little bit. So, if he knows how to adapt according to clearly defined principles, so the principles, it is not just giving a medicine to a disease, it has a principle behind it. So, one should be very acquainted with those principles. So, what is curative in medicines? To what he has discovered to be undoubtedly morbid in the patient. You should be very sure which is the disease of that particular patient, individual, so that the recovery must ensure. So, the recovery should must happen to adapt it as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him. That is, you should choose a remedy which is indicated in suitable dose and suitable potency, and also in respect to the exact mode of the preparation, quantity it is required, and the proper period of repeating the dose. If finally he knows the obstacles to recovery in each cases, he should be very sure which medicine is appropriate to ensure the recovery. So he should use it judicially rationally, and he is a true practitioner of the healing art. So I think this aphorism handles every queries and every questions that a beginner or a well experienced practitioner that is carrying in his mind. Okay, so this aphorism has everything: that knowledge of disease, what is to be cured in disease, what is to be cured in medicine, materia medica, then the principles, organon, dose, potency, remedy selection, follow up, obstacles to cure, and this is what a true practitioner needs for his healing art. Clear? Can you able to follow me? We will slowly move on from step by step process to make ourselves acquainted with the journey of homeopathic healing. Okay, yeah. So what is to be cured in disease, and that is an every individual disease? We will just have a little discussion over it. So what we think as a disease, are we going to treat a pathology as a disease or something else? So that is the reason why Hahnemann had put what is to be cured in disease. A disease is not a local affection. You must be very clear in that. The basic thing which you should have in your mind when you are approaching a patient with a pathology or a disease is, the pathology is not the disease, and the disease is far beyond that pathology. So it is not a thing that is only pertaining to an organ. See, if a patient comes with a diagnostic like asthma, simply prescribing an asthmatic drug like arsenicum album, Blata orientalis, Lufa operculata, etc., etc. So it's not an homeopathic way of dealing with the case. So you should understand that this particular pathology of asthma is an disturbance of something deeper inside the patient, which we term it as an vital disturbance in homeopathy, which may be connected closely to a kind of immunity imbalance or immunal system disturbance in modern terms. So, whether you are going to treat the asthma, the lung, or the disturbed system, so that is the query. That is the point you should keep in mind when you are treating every disease, whatever the diagnosis, whatever the pathology in front of you. It is just an outcome, and something is deeper than that. So you are going to treat that. So we have to treat that immune system, which makes the system to express as an asthma, right? So this, in this aspect, you are making a disease as an holistic disturbance. So it is a disturbance of the whole individual. So you are going to treat the individual, not the disease. So this is what you should first learn about what is to be cured in disease. And every disease is individual because it has its own peculiarity according to the person where the disease resides. Okay, right. And the second thing is, what is curative in medicine? So every medicine is curative, right? But what is curative in medicine? So according to Hahnemann, in homeopathy, we know that if, as like disease, every medicine has its own peculiarity. For instance, you can see Calcarea patient has enormous head sweat, right? So there may be another medicine also with profuse sweating like silesia. But what differentiate silesia and calcarea carb? You should try to learn the nuances of the medicines where it gets differentiated subtly, which makes the medicine individual. So you can see silesia and calcarea carb both are from mineral kingdom. When it comes to calcarea carb, the sweat profuse is mainly over the head, back of region and chest. When it comes to silesia, you can see the sweat is more profusely on the palms and soles. Both have offensive sweat. So these are some symptomatic differentiation between the drug. So if you go little bit deeper, a calcarea carb is a mineral remedy that is in the fourth row of the periodic table, and silesia is a mineral remedy that is in the third row of the periodic table. So the source quality or the source from where the medicine has been prepared will bring out certain qualities. So calcarea carb will be very slow in reactive pattern, and silesia also will be a slow reactive pattern. You know, silesia is a sand, calcarea is a lime, caustic lime, right? Okay. So these kinds of minute differences to the core you should try to learn. You should try to differentiate within each remedies. So learning materia medica should be very perfect. So when you understand a drug, that is how you are going to understand a patient. So if you are understanding a drug through keynotes, we have different varieties of studying materia medica. You can read a materia medica with keynotes. Alan's keynotes, which is a basic materia medica book we use for academic purpose also and also practicing also. So where you have enormous keynote symptoms, right? So if you are taking an arsenicum album, the fear of death, mental and physical restlessness, gangrene, pathology, tuberculosis, all this comes under arsenic. So you see mixed varieties of symptoms with keynotes, pathological symptoms, emotional symptoms, and PQRS symptoms. So when it comes to PQRS, keynotes, emotional, so this is how you understand a drug. So when a patient comes in front of you, if you have well versed in keynote symptom, you can understand only the keynote symptom in the patient, right? So when you understand a materia medica in a deeper level, at a source level or an emotional level or as a delusional level, you can understand the delusion that patient expressing, the source language the patient expressing. So all these things are depending upon how you understand a materia medica, right? So how to adapt this? By learning a knowledge of disease and a person as an individual, and by learning the knowledge of materia medica, how to integrate this? We have to need to integrate it, right? So when we apply this knowledge according to the principles in treating the patient, we will be able to bring a healing. So that is what Hahnemann has described in his aphorism. So for this, we need to use other skills of using repertory, the art of case taking, the art of potency and dose selection, and other case management strategies. So everything should be integrated together with the homeopathic principles, and you should apply this on your practice. So as we know, these principle laws and principles of homeopathy, right? So the law of similars. So whatever the medicine you are choosing for a patient should be a medicine that is based on a similarity of the symptoms. So when it comes to similarity, the similarity has different levels of intensity as it is. So you can choose a medicine based on just a disease similarity, which is not 100% homeopathy. You can choose a medicine on the basis of emotional symptom similarities. Say, for instance, fear, fear of death, weeping tendency. If a patient weeps, we give immediately pulsatilla. If a patient weeps when narrating her complaints, we will think of natramur and will prescribe natramur. So an emotional kind of similarity, some symptom similarity. Okay. So whether this is good or bad, so we will discuss it in upcoming slides. Okay. So the second thing is you should always give single medicine. So the law of singulinum. The medicine which you chose with symptom similarity, single medicine should be given in minimum dose. The medicine which we prescribe should be an dynamic medicine, or a potentized dose should be given. That is, that medicine should have been proved through homeopathic drug proving, where all the informations of the drug is well explained in a precise manner. So when you are prescribing a medicine, you should be very clear that you should have individualized the medicine. That is, what is to be cured in disease, what is to be cured in each and individual disease, each and individual medicine. So that is individualization. And whatever the individualization you are doing should be at an holistic level, which should cover each and every aspect of the patient, which should be very deeper. So all these principles should be integrated in your prescription. So you should be very clear in this. So what these principle teaches. So when we integrate all these many principles of homeopathy together, we can consolidate our homeopathic practice into three aspects. One is the holism, other one is the individualization. On these two bases, we are finding out a simillimum. So it is very simple. So whatever the disease or health or a cure, all should be in an holistic way. It should make the person as a whole into a better well-being, right? So how to achieve this? So when you say holism, you can't take one aspect of a person as a criteria. So you should have an generalizing concept. That is why Hahnemann told the totality of symptom, not one single symptom will indicate a medicine. It may indicate, but it should have an integration with other parts of that particular individual or the particular remedy. How you see? You can see, you can take the same calcarea carb. The calcarea carb has the first keynote symptom of calcarea carb is deficiency in assimilation, nutrition. So this is the primary issue of calcarea carb, where this particular keynote runs throughout the remedy, and all the pathogenesis of the drug will be connecting to that one particular point. You will see the open fontanelles in the calcarea carb baby, which is due to the imperfect assimilation of calcium. You can see the calcarea carb baby will be very weak. Even the profuse sweat itself a symptom of weakness, which is due to the uh, defective in nutrition, right? So you should treat and you should understand the holistic concept in disease, medicine and patient, right? And You should be well aware that individualization is must. Every individual is different from others. So each have different patterns and unique nature. So every case we see is a new case. We should not be over prejudiced with what we have learned or what we have in mind. So we always try to find an individualistic feature in that case to treat that patient. So when these two combines together, you will get the perfect simillimum. So the individualization and holism, holistic concept, these two are the major thing which will brought the simillimum together for healing, right? So this is the working principle of homeopathy. Whatever the things you take in homeopathy, everything will be fitting into this. Okay. So these are all the theoretical parts which we need to understand. So how to do this, how to apply this in practice. So when we try to apply all these things in practice, whatever may be, whatever the individualization, holism, case stick, whatever may. So what are the challenges we are facing here? The first is, as I said earlier, the confusion, right? Nowadays, if an homeopath comes, as someone asked, um, how to handle YouTube patients, someone have asked that. But how to handle YouTube doctors is also another problem. So nowadays we get more suggestions, more clinical tips, more kind of theories, whatever experiences they have, everything is getting pulled under one channel, and they keep on getting confusing. You can see numerous webinars are happening, numerous varieties of teachers are coming up, numerous methodologies are coming in front of us. So what to choose, where to choose, how to get clear with these different aspects as a beginner. Okay, so what is the reason why this confusion comes, right? Because we used to see patient in an one-sided way, as one have asked how to treat a one-sided disease, right? So in a one-sided way, when we approach a patient, we will not be able to get the exact result what we needed. So it's like an five blind man who try to describe an elephant by touching it. So you know the story well, right? So this is the major weakness. So in a case, every method or every teacher or every approaches will have success and failures. So which one to learn, right? This is a big question. So every homeopath stands at a different level of experiences. As I said, every method has some. This method is also having success. So I am trying this, and after some time, okay, this is not working for me. I will try this method. Then after some time, okay, this is not. It's also not good. So I will try this method. So this is one common mistake as a beginner what we do. We are not sticking to one particular method, or we are not learning one particular method or an aspect or a teacher. We are not following one particular teacher, or we are not following one particular method in a consistent way. So first thing is we should have an consistent way of approach in learning, in treating, both, right? So my advice or my experience says that whatever the method you are looking to learn, whichever is applicable for you, whichever is comprehensive for you, so learn that method fully, thoroughly, to the core, and practice that particular method with success and failures at least for a minimum of 3 years of period. So this will bring you an consistency in understanding the method and knowing your positives and negatives, that is in the method and in your approach, in your learning everything, and you start working on it again and again, then you will become consistent in your practice, right? Can you follow? Any questions at this point of time? Any questions at this point of time? Shall we move further? Okay, good. So if we are able to do such a consistent approach, okay, so we can have an consolidated or a constant way of approaching a case. You cannot say it's a constant way, a fundamental thing that you need to know how to approach a case as a beginner. Okay. So the first thing is whatever the knowledge you have gained so far, that should be very clear and precise. You should be with the principles. Any knowledge that stands contradicting the principles will not help you for a long lasting practice. So that's the first thing you need to notice. Okay. So the next is flexibility in method. So try to learn every method in depth. Don't be resistant to any kind of methods. Okay. See what is there in the method. What is that is making you, what is very easy for not easy, what is very how to say that, very comprehensive for you in that method. Okay. So even though you are having learning or knowing many kinds of methods, but be strong in your fundamentals. So any method that is contradicting the fundamentals of homeopathy will not help you for long lasting practice. And also you should know even the materia medica and repertory, which is very fundamental for our homeopathic practice, is also an incomplete. So sometimes you need to think out of the box within the principles, right? So if it is so, then how to choose a method? So you should choose a method according to the patient. It is not like the method what you have learnt will suit for all kinds of patient. You should, patient is the deciding authority. You should be very open to it. So see what the patient says, how the patient is. Okay. So according to the availability of the symptoms, what kind of symptoms the patient is presenting in front of us. So when it is a one-sided disease, what method should I take? Okay. So usually when in one-sided disease, the basic method which has helped me a lot in my initial days of practice is Boger Bonninghausen's grand generalization method, right? So where a key symptom which is very local or one-sided, the only available symptom can be generalized to that particular individual. right? So according to the levels of symptoms, so what kind of symptom you are getting, whether you are getting more mind symptoms or you are getting more delusional symptoms, whatever the symptoms that you are getting, you choose a method of approach according to the presentation of the symptomatology. So the which method to choose will be decided by the patient, his symptoms, and the level of the symptoms, right? So one should not stop with only the symptom what the patient is presenting with us. So you should try to explore all aspects. As like materia medica, you see a drug has all kinds of symptoms, right? Starting from diagnostic pathology to source level qualities. So the bryonia has least motion aggravation. So when you see it as an symptom, you will localize it only for a knee joint pain. But you can see the entire bryonia will be aggravated by any kinds of motion. So you can see that motion aggravation can be seen in both physical and mental plane. Bryonia is a very irritable drug. If someone disturbs it, it will get irritability. So this is least motion aggravation. So how the symptom is presented, try to explore all kinds of possible doors that is opening in the patient. Okay, nothing should be taken as a partial counting, right? So you should complete the case with whatever the possibilities that we are having in front of us. So when you are much satisfied with exploring the case with all the details, then the most important part of prescription is analyzing the data. So you should synthesize all the information and you evaluate the case with all possible tools, and finally you have to select a similar. So when you follow these general instruction in approaching a case, mostly our prescription will be very exact and complete. So just like prescription won't work in homeopathy, right? Okay. Any questions at this point? Do you have any queries now? Yes, Asta. Okay. Mm, where is it? Mm, 1 second. Yeah, right. So with this general outline planning, how to approach a case taking, we move one step ahead. So what are the things that we need to keep in mind when we are taking a case? So the first thing is, observation, right? So in a case taking, as we said before, the qualities of the physician, what Hahnemann describes in aphorism 83. So attention in observing, right? So the initial time space in a case taking is very important. So you should observe the patient. A patient can be very calm with a severe pathology. A patient can be very restless with the minimal pathology. So the patient who is very calm and composed with all this, it's okay, it's always, yeah, it's okay. His remedy may be different. Patient is very anxious, like an urgent of night, no, it's very anxious, nervous, and doing that and that. Oh, you see, my nose is running. So how he behaves in front of you, how he is, what makes him to behave so, who he is. So that part of case taking is very important, which you have to be a good observer in that point. Okay. So the second thing is scanning the keys. So you keep on asking the details, the patient is giving you the details. So you just have an outline of the case. So what are all the symptoms that the patient is presenting? So what are all the common symptoms? What are all the uncommon symptoms? What are all the characteristic symptoms? Which are all the mind symptoms? Which symptoms should be taken into account? So all these things you have to just scan a case. After taking the case, you should be able to see what the case is with all the details. So that is very the second step of a case taking process. Then the third thing is identifying the most sensitive part of the case that can be called as an hotspot or an entry point. See, a case may be just going like this. Simply, I am having this pain in my hand. It is very troubling me a lot. You see, doctor, and so what's the thing? You see, doctor, because of this, I am not able to do any work in my home, and I'm getting more irritable. Okay, what makes you to do so? I'm just getting anger. I'm throwing things. I'm beating my children. Everything is happening, and suddenly the patient stops for a while, and she just starts weeping, and you can see there might be an energy shift in the flow of the case, where he enters into his sensitive area or her sensitive area, and her behavior pattern, everything will be changing, and the patient's flow will be changing. So you should just look where the case is getting changed, where the patient is having more energy in describing his complaint. Some patients may not talk about their complaints, they will come and talk about something else. Okay, so you just ask about it. What is it? What is it? What is it? So that will bring out some unique nature, the individualistic feature of the case. So you should try to analyze these aspects in a case. That is one important point. So when you try to elicit as much possible sensitive points and all those things in a case, then you try to find the exactness of that particular sensitivity, how intensify it is, whether it is really an important thing in a case, whether it is individualistic, whether it is holistic in the case. Okay, so this is like you are finding an exact fingerprint of that particular case. So you see, every fingerprint is unique, right? But that one fingerprint will have the entire data of the patient. So you should find such a data in a case. Okay, if you have arrived at such an concrete, sure, complete, characteristic, peculiar, holistic, individualizing information in a case, then your prescription should be based on that particular symptom complex. So that is called anchoring a case. So anchor a case at where you are very sure with individualization, where the patient can connect in a holistic way. Okay, so your prescription should solely be based upon that particular symptom complex. So this will bring you an complete case taking process by arriving at an exact remedy prescription. Can you follow this? Okay, great. So let us see one example of a case where we can apply this process in practice, right? So, case. Can you see my slide? Can you see my slide? Okay. So you can see, so this is a case of a 3 years old child which was treated by me some 2 3 years ago. So this child was diagnosed with certain autistic feature, and it was not in complete autism, but the child was having some developmental issues, and he is not a normal child. So the symptoms were as follows. So the child is very restless. It's keep on running here and there in the clinic and always jumping at the point where he is standing, and he is not sitting at one place. And when they brought the child into the clinic, the child not able to take steps on the stairs. Such a fearful child, and her words, the pronunciation were not very clear. It keep on repeating the same words again and again, spontaneous, without any reason. So the child is in his own world. As you see, the autistic child will be like this. So he cannot frame a sentence. He never says anything. He will be like just as it is. So some symptoms like handling the genitals. When he becomes restless, he used to hold any objects, or he used to hold any something near to him. Okay. So lot of issues are teeth grinding. He cannot able to chew the food. He can't swallow it. So there were a lot of issues coming in the child. So there is stiffening of body. So whenever the child, if someone approaches the child, it will do like this. It will do. So even when someone observes the child for a long time, it will do like this, a kind of a panic attack like thing. So it won't touch anything with his hand. He will just avoid touching even the food while eating, and he won't masticate the food also well. He will just swallow it. So the patient was the parents were observing that he is not mingling with others, he is not playing like others child. So what if even something wets in his palm, then he wants to wash it immediately. He won't respond to anyone, he won't answer to any questions. He is not playing at all. So he talks something randomly here and there and not related to what asked. He will just all these things are happening, and there is a family history of some psychiatric illness also. So he won't write on his own, want supports during writing and walking, has to hold his hands always. So you can see the gesture here. This is how the child will do this. This gesture was keep on coming again and again in the case when the mother was narrating the complaint and everything. So I was just observing the child for a while. So other things you can see the generals, sweat, forehead, nose, nape of neck, disease, sweet sleep position. While sleeping also his position is over the eyes. He will put the hands over his eyes and lying on side. He will keep his hands like this, thumb inside his hands, and he will hold it with the fingers. So there were dryness of lips. So you can see the teeth of the child with enormous gapping. The teeth were just like sharp pointing teeth. So with carries, lot of carries were there. So there were delayed milestones. Everything was happening. So the mother was feeding. Mother feeding was 2 years. It was regular. So anybody getting any idea about the case at this moment? Any idea? Any thought? What remedy or what shall be done with the case? Calcaria. Good. Why calcaria? Yes, Dr. Vishal, you can speak. Why calcaria? Most of the symptoms belongs to the disease. Yes, good. Yeah,
Delayed, sir. Late reactions
late reactions, good,
and cannot do anything on his own,
good.
and stools are not regular, 2 days once,
Okay. Anything else to add?
and wants support during writing and walking, has to hold his hands.
Okay.
It's characteristic in calcarea, like wants someone, always wants someone.
Okay. So, do you think whether all these symptoms are there only in calcarea? Can we think of any other remedy with similar symptoms? Weakness, delayed in walking, dependent,
Calcarea phos,
calcarea force, good. Why not Beretta car?
yeah, that also comes.
So Beretta carb is also having this. weakness, timidity, dependency, not able to walk, delayed milestone. That's it, right? Can you follow? What you are saying is correct. It can be calcarea card.
Yes, there is.
But how to differentiate it from others? What we can do at this point? Anyone can speak, answer. So what can we do at this point? So we have received certain set of symptoms which have been narrated by the parent, and we have observed certain symptoms. So we have behavioral symptoms, his physical symptoms. So we can able to think of some remedies like calcarea car, beretta car, calcarea foss, etc. So which remedy to give, how to proceed further? Anybody? Anybody else? Okay. Good, Dr. Vishal. So we shall apply what we have learned so far. Okay. So the first thing is how to proceed this case. We need a systematic approach to the case as we described earlier. So every case is an individualized case, and in case taking what we are doing is we are doing an individualizing examination, right? So what we can do next? Slide is not changing. Yeah. So the first thing is, as we described, the observation, right? Okay. So what we observe in the case, the child is very restless, the child is very fearful, he is impulsive, he keeps on repeating the same words spontaneously, but his speech is not clear. His hand gesture, which stands out of all his physical symptoms, right? He stiffens his body like this, like this. So no eye contact. This is common in autism. So there are more gaps between the teeth, and the teeth edges are sharp and they are caries. So in common, there are more developmental issues. So if the child may be autistic. So in mother, we can see that the mother is also somewhat restless. She came with a notebook where she has written all the symptoms of the child with perfect written down things she came. So this is what I first noticed with the mother and the child. Okay, a step by step approach. So what we first need to do is whatever the medicine we are going to prescribe the child should have all this observed features also, right? Okay. So then second thing, so these are the informations which we have got so far. So usually in a pediatric case, if we need more information, what we should do is we should ask the pregnancy history of the mother. So where the mother's nature and any stress or complaints during pregnancy will be elicited, it can help the case. It may help or it may not help also. It depends upon the what kind of information we are getting in that case, right? So we should remember while treating a pediatric case, not every time the symptoms from the mother or the pregnancy history will be suitable for the choice of the remedy of the child. So anyhow, we are going to treat the child, not the mother. So you should be very clear in that aspect. So when I started asking the mother about her symptoms and everything, so the mother was telling some physical symptoms like vomiting was there continuous. So because of no pain, they did C-section and all these things. So one point which she told was that a stressful situation during pregnancy was happening between the family, where the mother is so angered that he could not tolerate that. So he could not manage the issues that is happening in her family. So at that time, while expressing this symptom, the mother expressed the same hand gesture like this, like this. So this hand gesture which the child made was expressed with the same intensity with the mother in the same gesture. The difference is the mother had it in the anger and the child was doing it in fear. So this stands very peculiar in the case. So this is the hotspot. So this is the hotspot in the case, right? So while scanning the case, you can see the developmental issues in the mother, physical generals that we have received, and the mother's nature, her stress during pregnancy, and psychiatric affection. So all in the family. So all these are counted for the analysis of the case. So the two things which stands very energetic in the case was stress during pregnancy and peculiar hand gesture, that is this clenching of the fist. Yeah. So this is the entry point to the case. So when I asked the patient about describe this gesture, what you are doing this or what you are feeling when you are doing like this. So she was talking some other things that comes to her mind, and she was telling that to this, if I could not balance, I just do like this, I am unable to balance the family. So here my mother is telling something, here my brother is telling something, I am just, I don't know what to do like this. So this gesture, what is his inner feeling, that she is out of balance. Okay, out of balance, which means not strong, weak. Okay, so this peculiar outstanding symptom in the case gave an entry to know what could be the cases or what could be the remedy is. So at this point I anchored the case and explored the case, and I arrived at the remedy. Okay, so at this point, what we should do? We have got a peculiar case and more information and a deeper view of the case. So at this point, what we should do? Any idea? Hello? Any idea? What we should do at this point? How to use our knowledge here? What we should do after identifying the hotspot, after identifying the sensitive area, after identifying the uh, PQRS in a case? What we should do?
Sorry, ailments from it is already we got there.
Okay.
So we need to take those symptoms and give running background in the sense main core of the symptoms has to be taken and given medicine.
Yeah, that's true. So what we should do? How we get the medicine? What is the process? What is the regular process we should do as a step when we are done with all exploring the symptom and
Totality,
analyzing
sir.
totality? Yeah, we have arrived at the totality. Then what else? We should find search for the remedy where the symptoms are present, right? Repertorizing. Yeah, repertorization. So we need to find the exact symptom match for that particular symptom. So we try to understand the hand gesture by exploring those symptoms, like the patient was coming up with lot of issues, the family, financial matters. I am losing the relationship. I cannot balance. I need support. Others, what others will tell about me. I don't know what to do. Confusion, dependency. So everything was coming on. So it's done with exploring the what to say, the peculiarity. So after all this, you should search for that particular symptom. You have to match the fingerprint, right? Exact, which is holistic. So this is what the case is, right? So fear of mistakes, stammering, anxiety. So all these were happening in the case. So one hand gesture that is connecting to the mental state of that particular patient. Here in this case, it is the patient of the it is the symptom of the mother which is getting connected with the child. Okay, so at this point, the common thing which connects both the mother and the child is gesture, which is an deeper level symptom. So we are considering this as an individualizing characteristic symptom in this case, and we look for the remedy. So the pattern what emerges with the child and the mother are pointing out to some common remedy, that is calcarea cord. So you can find the remedy, the particular symptom that is in the child. You can see nerve repertory. You can see mind, fist doubling as if in furious anger. You can see one single remedy calcarea cord. So I tried to search that particular peculiar symptom in the repertory and I found out calcarea cord. Then I didn't give the remedy immediately to the case. I keep on probing that peculiar symptom and want to see what are all the other aspects that is coming up with the peculiar symptom, whether it is in line with the remedy what we are searching for or what we have got in the totality. So all these issues were holistically pointing out calcarea car. So you can see this lacking something. There is developmental issues and want to cope up, organizing responsibility. You can see the mother came up with this paper, cleanly noted the symptoms and everything. All these are some hint to a mineral remedy where with a deeper understanding of the materia medica, you can see there are more issues of row 4 coming up in the case. So need for security in terms of money, relationship and job, health, everything. So and the patient, as you see, the child is more dependent, weak, and the mother is also experiencing dependency and weakness incapability, which is a nature of column 2. So we narrow down to the remedy calcarea carb for this patient. So if we are prescribing a remedy based on, as we discussed before, right? As Dr. Vishal told rightly about calcarea carb, but on what basis? We took some common symptoms which are shared by some other remedies also, but he suggested calcarea carb, which is the right remedy, but we are not very sure. Okay. So, but when you try to understand and approach a case with the fundamental knowledge in a step by step process, in a general guidelines, you can be very sure and very exact of what you are selling. So, this kind of analysis and approach toward the case will make you more consistent in prescribing the exact simillimum for that case. Okay, so this case was prescribed calcarea carb with this broad understanding. Okay, so I have reported the entire case, the rubrics of the child and rubrics of the mother. All the symptoms were taken into consideration, and then with all the understanding of the approaches, the method, the basic symptoms, and the materia medica. So the remedy was prescribed was calcarea carb. Okay, so this is different thing. So calcarea carb was prescribed. So after prescribing calcarea carb, you can see the changes in the case. So this is just for records. You can see the child which doesn't allow anyone to touch, or he won't touch anyone, started to mingle with others and started playing with others. These photographs, everything were sent by the parent herself. So you can see the smiling in the child, the teeth have been changed, and all his natures were keep on start improving and improving and improving. See, so this was her first coloring picture where he was not very sure. He is not concentrated in doing that. So later he got oriented in coloring. You can see the change. And now the recent picture what the patient has sent was very excellent, perfect coloring. Even the shades that has gone out of the picture was not present in that recent picture. So you can see here the child started to play on her own, mingling with others, doing exercises, playing. All these things were started developing, and now the child is better. So it is almost from 2023 to now 25. Still, the child is under my surveillance, and the remedy which prescribed was calcarea carb, and the last prescription was LM12, calcarea carb LM12. So with calcarea carb, the child is progressing a lot, and he is having a regular schooling. He is more or less near to a normal child now. So this kind of consistency, you can be very sure of giving a medicine, can be done only with a consistent way of approach. So you consistent in the sense it is not a constant. You should be flexible according to the case, right? But the general rule and structure of case taking, structure of analysis, you should have a clear idea before approaching a case. Okay, can you follow? Any questions at this point?
Dose detail, please.
Sorry.
Dose का detail दें, please.
हाँ, dose, the child was started with calcarea carb LM1 followed by LM8. So usually I prescribe a water dose method, and mostly I will follow LM potency. So there were many case management strategies were happening in that case. So I used to alter the dose, I used to alter the potency. So all these were happening, but the remedy was not changed. Only the dosages were changed and potency were changed. So after giving Calcarea carb 1 the child had severe fever and it was very difficult to manage. So after giving that, after looking at that aggravation, I realized that the potency is too high for the child, and even the centesimal has caused more aggravation with the child. So later on, I gradually reduced the dosage of LM 1M potency in water. Then I followed it with Calcarea carb LM potency, LM8. Then slowly, the aggravation were reduced. So after that, making the remedy very sure, I started with LM1 of Calcarea carb and gradually ascended because the child had severe aggravation. So I don't want to put the child at risk. I started gradually from LM1 and ascended till now the child is in LM12. Is it clear?
Frequency, sir.
Frequency in these 2 3 years, the child would have received medicine in first 3 to 6 months. There were daily doses, and after a striking improvement with the case, the doses were reduced. There were weekly doses, and now the child is getting monthly doses. Monthly once the medicine will be repeated. Any other question?
Sir, it's there in synthesis also, sir.
Yeah, it can be seen in
Mind this.
synthesis also. So this is how a prescription can be very sure and clear and exact. Okay. So usually what mistakes as a beginner or even as a practitioner we can do is one is hurry in prescribing. So once some known symptom is popping up in a case and suddenly some remedy strikes in our head and giving that remedy in a hurriedness. So that is one common mistake we do without analyzing the case, without looking the case in a holistic way. We used to prescribe remedies. So when we do such prescription, what will happen is we may need to change the remedies frequently for a case. So the reason why I chose this case is you can see it is almost 2 years now that almost 3 years now the child the he is only under Calcarea car. So no other remedy was given. Even whatever the acute conditions he is facing in between was cured by the same remedy. So because we have chosen the remedy based on concrete principle and complete understanding with a consistent method, right? So the hurry in prescription or frequent changing of prescription when we give a remedy, you see the child after giving calcarea or one suddenly there was an aggravation, severe fever, everything came. Suddenly we should not give a medicine for a fever. We should not keep changing the remedy immediately because when we will change when we are not very sure of that remedy, but we are very sure that this is the remedy. So we studied the case and altered the dose, and the child was better. Even and one more autistic child was there, and she had received natramure. So after natramure, the child was totally in a sleeping condition. For 1 week, the child was keep on sleeping. Nothing was happening. But I am very sure the remedy was natramure. But after 1 week of that drowsiness and sleepiness, the child spoke a word which she hadn't done for almost 8 to 10 years. So since then the improvement started. So when you are very sure of remedy, sure of the remedy, when you are very confident in your prescription, that confidence that comes from your knowledge, skill, everything. So you should not change the remedy. So changing the remedy, one common mistake that we are doing. So then second thing is therapeutic prescribing, just giving a remedy in the name of a disease. Okay. And prescribing some remedies of unknown, unsure symptom. So just for the sake of that this symptom is in this remedy, so I am giving this to that patient. No, it is not like that. Then the negative prescription, like if you say, if a patient says that I am aggravated from cold, that doesn't mean that he is ameliorated from warmth. Okay, so some may interchange this and give prescription. So that should not be done. And overemphasis on single symptom. Usually we all have a say. See, if someone falls down, immediately we will give arnica, right? So falling down is not the only symptom that is going to indicate arnica. For contusions, we have numerous remedies. So, what is the experience of that patient in that particular incident will give you the individualistic nature of that patient. So, you can treat with that individualistic feature. And the next thing is getting trapped in methodologies. So, we always see a case to apply some method into that case. No, that should not be done. So, you should have some flexibility in approaching the case, which we learned earlier. Okay, then the remedy genuineness. Okay, so we should use very good quality remedies for in our clinic and practice. We must be very sure that remedy should work. Okay, that is. So then unwanted repetition. So just repeating the remedy just like that. So I am using LM potency. LM potency can be repeated anytime. So I will keep on giving it. No. So there are certain laws, rules, how to choose a potency, when to repeat a dose. So we should be always be with the principles in each and every step of the case management strategy. Okay. So when it comes to follow, so we have certain list of categories where we face the changes of the follow. So whatever the strategy that is we are going to tackle down is with the medicines you are going to do only these four actions. One is you will wait and watch, the second is change the remedy, and the third is change the potency, and the fourth one is adjusting the dose. Only these four things are the basic fundamental strategy that we are going to deal in a follow up. So what kind of possibilities can we see? So these are all 12 possibilities. There are 12 major possibilities that we can see in a practice where we can decide whether to change the remedy or change the potency or adjust the dose or to wait. So one is like immediate improvement without any aggravation. So which means that the remedy is correct. So the remedy is acting. So there is no aggravation, there is no new symptoms, but there is improvement. So this is the thing where the remedy, potency and dose are correct. So at this point, you no need to do any change. You just wait. Okay. So the second thing is no reaction. So when there is no reaction, then there are more possibilities for the remedy to be right, but the dose and potency may be low. So at this point, you need to increase the dose or repeat the medicine again. So these actions to be taken at this point. So you can see the other thing is the initial improvement with relapse of same symptoms. So you prescribed a remedy, there was an improvement, and again the same symptom is coming up. So which means that your medicine is correct, potency may be also correct, but the dose is not enough for tackle that vital force. So you need to increase the dose. Then improvement with short aggravations of same symptoms. Long aggravation followed by progressive improvement. Long aggravation indicates highest potency and has been given to that particular case where the aggravation has happened. Just I described in this case where the child has heavy fever after getting the dose. Excuse me. Any questions at this point? So there is aggravation. Whatever the medicine, whatever the dose you are giving, there may be aggravation, which indicates that patient is very hypersensitive. So the symptomatic improvement, but the patient is weakening, which shows that you are palliating the case because the patient is getting weakening. So the suppression is possible, or there may be any other deep pathology which you have not addressed with your prescription. So there is fast amelioration followed by long aggravation. Here also the medicine may be partially similar. So long-term amelioration followed by aggravation. So if you keep on giving an LM potency regularly, there will be an amelioration for long term, and at an end there will be an aggravation. So this indicates you should stop the medicine, the dosage is enough. So relapsing of past symptom, which is well known as Herring's set of cure, where you can wait. So if new symptoms are appearing, you see the accessory symptoms of the medicine or the disease, then your medicine is wrong. So you need to change the remedy. So these are all some general instructions about the follow-up where you can keep in mind. Okay. So we need to, every branch of this is a detailed subject to study. Okay. So, and when you are treating the case and considering all these things, you should be very careful in removing the obstacles in a case to cure also. So, the obstacles can be like lack of awareness in the patient. So, patient may not know about what you are doing, what homeopathy is, what kind of presentation of symptoms that the patient should come with. So every patient will come as like an allopathic doctor. So you should educate the patient to overcome those obstacles. So homeopathy is this and that. So for a homeopath, these details are needed. So all this can be done by giving a pamphlet to the patient or sharing some awareness videos to the patient. So this can be done. Okay. So sometimes the patient may give very less number of symptoms. So this may be one of the obstacles. Sometimes everything will be fine. The patient may not have followed the medicine instructions properly. He might be taking in some other way, which make the medicine may not be acting on that patient. So negative influences from the surrounding. So, oh, why are you taking homeopathy for this complaint? Homeopathy will do this, will do that. Many influences will be happening around the patient. So you should able to assess those kinds of things also. So the other one common thing is excessive use of medications. So nowadays people are telling many homeopathic medicines for this condition, that condition. In YouTube's videos, doctors are practicing like that. So what this will cause? Okay, only we know what homeopathic medicines can do. Homeopathic medicines can do more worse effects than an allopathic medicine. Even an allopathic medicine has a definite time duration for action, and we have definite effect of those medicines if the side effects can be assessed. So excessive use of medications can be also homeopathically also. You should be aware of that. Then finally, the lifestyle factors of the patient. So sometimes the disease may be totally incurable. That may be an obstacle for a cure. That may be a limitation for our prescription to be in success. So, and other common reason for obstacle to cure is we may not think out of the box with the materia medica, because we might be having a limited knowledge of materia medica. Just like as we are, if we know only calcarea carb as a child which has a sweat on the back, we won't be able to prescribe calcarea carb for this child. So like this. So limited knowledge of materia medica is one obstacle of cure. So the other thing is clinical management, the final thing. So first thing is start and set up your clinic. So once you have prepared yourself, when you are inspired, when you are ready, when you are trained under an homeopath, then set up your clinic practice, start your clinic practice immediately. So I started my clinic practice the day after my homeopathy council registration. One day after my internship has completed, I started my clinical practice. So where to invest, what to invest in clinic, how to get more patients? That was also one question that has been asked by some participant. So you should be very clear in where you are investing your energy and money. Okay. So investing your money and energy in your clinic interiors and show of everything, advertisements, all these things may help, but more than that, you should concentrate more investment in your learning, making yourself skilled with reading books, getting proper medicines, having and regular educational activities like attending seminars or courses, make you keep updating with yourself, and have good analyzing tools like softwares, whatever you are feasible with. Okay, so this is very important and thing. Then when it comes to maintenance of clinical records, so there are many things are now you should have a proper recording of your cases, either digitally or manually. And not even with that, you should have a self review. At a periodical self review is necessary. So how many patients you have seen, how many patients have improved, that assessment should be happening very frequently within you. So this will keep improve your management strategies. So you will get more plans. Be ready to accept failures and move on with the lessons what you have learned. So build a rapport with the patients genuinely. Be compassionate with the patients. So this will help you to improve the clinic and improve yourself also. So healing others will heal yourself. So that is what homeopathy will do to you. Right? Sorry. So these are the major points which I want to discuss. Um, I believe that I have served you some kind of tasty dishes for you. Let me have some feedbacks. See, my purpose is not to teach you tips like for this condition you give this, for this condition you give that. No, that won't help you for your lifetime. So this is the word you always remind. Give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. I want to feed you for the lifetime. And all these aspects which we have discussed in this session are just a drop in a ocean. There are many long way to go. As a beginner, I feel that you take this as an inspiration and grow yourself to become a successful homeopath. And as a part of homeopathic community, um, we will be always ready to help you in your successful career. Thank you. Any questions, any suggestions are welcome.
सर इसका पीडीएफ मिलेगा प्लीज.
Sure, I will share it with you. I will send it to Dr. Yamini and she will share it with you. Can you give some suggestions to female doctors who practice after a break? Get inspired, learn, read. See, usually what I advise for a female doctors who, as a female, they have more responsibilities in managing their career and family. They may face more challenges in managing their career and family. So keep balanced with your thought process. Be ready to let go certain things. Be ready to accept certain things. The most important thing which I forgot to mention is have a teamwork within yourself, within your colleague. Have a constant touch. Used to read one page of any homeopathic book daily. Make reading as a habit. Daily one drug or one page of a drug or one symptom of a drug or one rubric from a repertory, any repertory. Just keep pondering over it the entire day and see what comes within you. So this will keep always the fire alive within you. So this is one small step to make yourself better every day. Dr. Sunita, can you can you follow it? Hope I have answered your question. Yes, thank you. So anything else? If you need any help to understand any concept in detailed way, you just let it know to Dr. Yamini or to me, and we will have specific sessions over it. Uh, so I hope Dr. Yamini is there.
Yes, I'm here.
Yeah.
So Dr. Dweep is asking, can you speak a little bit about LM Potency?
So may I know what exactly you need to know about LM potency? So because LM potency is in another version. Anything specific about LM potency you need to know?
How can differentiate LM potency patients?
LM potency in
How can differentiate LM potency patients?
LM potency patients. Okay. See, can you see the screen?
Yes.
Yeah. So Hahnemann had 3-point guidance for potency and dose selection. So one is nature of the disease, the another one is nature of the patient, and the third one is nature of the remedy. The thing is, usually what we do is we will see this is a pathological case, so we should give a low potency. This is a hypersensitive patient, so we should give a low potency. So this patient has more mental symptom, we should give a high potency. So the remedy is very slow acting, so we need to repeat the remedy very frequently. So these are all speculations and theories that we create with these points. But Hahnemann expressed this in a holistic way. Okay. So all these three things should be considered together as a whole in prescribing a remedy, which means that a perfect simillimum is the correct remedy, correct potency, and correct dose. So this is where Hahnemann was working for his past almost 8 to 10 years in refining the dose and potency selection criteria in organon. You can see from 4th edition to 6th edition, the principles were concrete, they were completed. But why Hahnemann was keep on putting more additions and additions to the organon was he was refining the method of choosing the potency and administering the dose where he wanted to reduce the aggravation. Okay, so reduce the aggravation. So you can see in 4th edition Hahnemann made 30C potency as a standard potency, and he advised one single dry dose, and he never advised repetition of the dose. Okay, so in 5th edition Hahnemann removed the 30C limitation, and he introduced water dose method in centesimal potency, where he allowed repetition in certain acute conditions. Okay, yeah. So why he was doing all these changes where he just want to make the cure without aggravation in a very rapid and gentle way, right? So this is one step deeper concept. Okay, so this is the reason why Hahnemann arrived at some arrived at the LM potency in the 6th edition. Okay, so why LM potency? You need not to find LM potency patients. So LM potency is an universally applicable potency method where it solves all kinds of potency queries in homeopathy. Okay, whatever the disease may be, whatever the level of the patient may be, whatever the nature of the disease may be, okay, whatever the nature of the remedy may be, you start with LM1 as a basic rule, okay, as how Hahnemann have explained in his aphorisms, how to dispense LM potency, okay. So you start with LM1. The way is one, you should be very sure of the remedy, and you start with LM1, proceed as it is, and LM2, LM3, LM4 as it is. So when the patient is okay with all his complaint, stop the medicine. So this is how the LM potency is very unique and complete. Okay. So Hahnemann spent his last 10 years in developing this unique potency to make an ideal cure. Okay. So this is about all about LM potency. You can dispense LM potency very um, flexible way, artistic way. Okay. Yes. LM potency is a different subject. I hope we can have another session on LM potency if possible. if Dr. Yamini agrees.
Happily.
Thank you very much for gold standard knowledge of organ and materia. Thank you.
Thank you. Thank you so much. Thank you for all your patience and listening in this holiday. I hope this will have you a great future ahead. Bye.
Thank you. Thank you so much, Dr.
Yeah.
Charuvahan. It was sheer pleasure and great time. We have learned the basics again, and also, recalled a lot of things which we tend to, sometimes forget or overlook in the practice, but they are very, very important to follow. Like you said, that, about potency, that there are three things which Hahnemann has clearly mentioned, but sometimes we just prescribe on one pillar. It's not
Yeah.
all the aspects covered. So that's very, very important, and thank you very much for your precious time and wisdom, and whatever you have shared was really, really important and useful. And like I can see in the comment section that people have enjoyed, Dr. Asta is saying thanks to me, but you should thank Dr. Charuvahan. It was really an eye-opening case, and I really want you to come again here for many more topics, not only LM potency, but we can, of course, talk about a lot of things. So
Sure.
you're most welcome, and we will definitely plan it very soon.
Sure. I'll be happy to join.
Thank you. Thank you so
Thank you.
much. And thank
Thank
you,
you.
everyone, for joining in, for your uh, time, patience, and your feedback, questions. Everything was very important. Please keep showering your love. And you can also suggest us what kind of topics you want to learn so that we make it more interactive, useful. Because the whole sole purpose of doing this series is that it helps you in the practice, the clinical practice, and it is very, very important. Of course, I also get to learn a lot by doing such sessions. It's a personal benefit primarily, and the later comes later, but definitely we want your support and your suggestions. They are extremely valuable. Thank you so much. We will see you in the next session. Next session is on, I guess, 23rd Feb, if I'm not sure, that is a Sunday after 2 weeks. And we will have a very special guest then also. So please do come for the next session as well. Thank you so much. Have a great Sunday ahead. And again, thank you so much, Dr. Charuvahan.
Yeah. Thank you so much, Dr. Yamini. Thank you, everyone. Have a good day. Bye.
Thank you. Bye bye.